Hi guys, it's me again. Today I want us to talk about something very important to our health as always, and um, maybe address one or two issues regarding our attitude towards taking of drugs. Okay, today I want us to talk about a very common group of medicines, a very common group of medicines uh, called analgesics. Okay, analgesics or painkillers, commonly known as painkillers. And so we have different classes of painkillers, and then we have what each painkiller does and what it doesn't do, what it can do and what it cannot do, and what potential damage what particular medicine can do. Okay, so some of us we misuse the drugs. Okay, some of us even use drugs that are supposed to be used for condition A for condition B. Okay, and some of us overtake the medicines. And so looking at this group of medicines, I think we have very common medicines that are not even costly. They are not costly, but they are very dangerous. They can be very dangerous to us if we abuse or if we misuse them. Okay, so we have properties of the painkillers. Okay, yes, painkillers have properties and they are majorly grouped into four. We have the analgesic property. The analgesic property simply means their property to cure pain. They have anti-inflammatory property, their ability to reduce inflammation or swelling of any body part. They have antiplatelet properties. Some painkillers have antiplatelet properties, meaning they prevent blood from clotting, okay, which can be good and can also be potentially bad. Now the last one is they have antipyretic, or some will say antipyretic. Antipyretic means they reduce fever or high body temperatures. Okay, yes. So I would like to talk about the most common of the analgesics or the painkillers, or the ones that we can just go to the over-the-counter medicine sellers and get, because some medicines are prescription only. Okay, we'll talk about that later. But then now we are going to talk about acetaminophen or paracetamol, ibuprofen or brufen, diclofenac, and then acetyl salicylic acid or aspirin. Yes, and so among all these four that I've mentioned, ibuprofen, aspirin, paracetamol or acetaminophen, and then diclofenac. But most commonly, they mention acetaminophen, acetyl salicylic acid, which is aspirin, and then ibuprofen. Now, we are going to go into details what these medicines do, okay? And then how we are going to use them for it to be safe for us. You might be using a painkiller, it will solve your problem, but then it will bring you a bigger problem. Okay. So we don't want to take a drug with the desire of curing ourselves, and then we in turn bring problems onto ourselves. So I'll start with aspirin. Now every drug has something we call contraindications and indications. So indications are what specifically the drugs are supposed to be used for, okay, or the ailment the drug can help alleviate or cure. Then the contra indications. Okay, if you look in some books, they say counter. Okay, counter indications. Contra indications are the conditions that one might have that will not make the person eligible to take the specific drug. So let's say you have asthma. Okay, you are an asthma patient. You are not supposed to take aspirin or ibuprofen. I'll tell you why. And that is a contraindication. If you are pregnant, you should be careful about taking aspirin. Paracetamol is safe for you as a pregnant woman. Good. Now let's take aspirin or acetyl salicylic acid. We commonly know it as aspirin, but then it is called acetyl salicylic acid. Now this is a very very powerful analgesic. I think out of the three, paracetamol, aspirin, ibuprofen, it is the least costly. It is the cheapest, but then it is the most potent too among the three I've mentioned. It can also be very very fatal or lethal to your health. It can kill you. Aspirin can kill. Aspirin can cause abortions. Aspirin can cause epistaxis, that is bleeding from the nose. Aspirin can cause ulcers or make ulcers severe. So aspirin should only be used when it is very, very, very needed. Why? Because there are other safe options aside aspirin. Paracetamol is the safest. Remember we mentioned the properties: antipyretic property, analgesic property, anti-inflammatory property, and then antiplatelet property. Aspirin has all these four. So aspirin can help relieve your pain, reduce inflammation, stop your blood from clotting. Okay, and it can also reduce fever. And so if you have a common headache or a mild headache, maybe from a hectic day, rest and sleep can do the magic. But then if you feel like you want to take medicine, probably to speed in your recovery, or you want to get well fast, then you can take paracetamol. That is the safest choice for you, because most of us are here walking around with peptic and duodenal ulcers, but then we have no clue, absolutely no clue. And so it is better, if you don't know much about your health, which most of us don't know, it's better you take para or acetaminophen for any pain you are going through. Okay? So before you take aspirin, you should be very, very cautious. Now, if you have ever reacted to taking aspirin, okay, we say you are hypersensitive. Hypersensitivity to aspirin, you are not supposed to take aspirin. If you are an ulcer patient, you are not supposed to take aspirin. If you're a pregnant woman, you are not supposed to take aspirin. Aspirin can even be dangerous for adults and more dangerous for children below the age of 12 years. And so if you have ulcer, or you have ever reacted to aspirin, or you have ever reacted to any of the non-steroidal anti-inflammatory drugs, okay, aspirin, ibuprofen, yes, don't take aspirin. Do not take aspirin. If you have ulcer, do not take aspirin, because aspirin is going to worsen your ulcer. Good. Now let's take ibuprofen. Let's take ibuprofen or brufen. Ibuprofen. People say ibuprofen, ibuprofen, brufen. We have it in different strength, like 200 milligram, 400 milligram. And so brufen is another powerful analgesic. Sorry, I said antibiotics. So it is a very common analgesic, and so we should also be cautious when taking it, because it also has antipyretic property. It means it can reduce your body temperature if you are experiencing fever or you are running a fever. It can cure your pain. That is, it has analgesic property, and then it has anti-inflammatory property, meaning it can also help reduce inflammation, but it doesn't have the antiplatelet property. It doesn't have the antiplatelet property. It means that this ibuprofen has 3 of the 4 properties we mentioned, but then aspirin has all the 4. Good. So some doctors say that ibuprofen can be good for pain that maybe acetaminophen or paracetamol cannot tackle or cure or help alleviate or reduce. Okay, so it has 3 of the properties. Now, before you take aspirin, make sure that you are